Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.
Let's move along from Dáil Daily to antidepressants and reading an article by a good friend of mine, Mr. Gabriel McSharry. You do know that Gabriel is a nutritionist, and he is also a medical herbalist, and he's based in Calgary in County Sligo. And there's an article in the Western People. I know that Gabriel has articles there regularly, maybe weekly, and it's about antidepressants, and says there are a lot of people on antidepressants, but the question is, are antidepressants likely to do you more harm than good? Gabriel, how are you?
Good morning, Johnny.
I'm just looking here. It says commonly prescribed antidepressants appear to be doing patients more harm than good, say researchers, not you and I, say researchers who have just published a paper in the journal in Psychology, April 2012, examining the impact of the medications on the entire body. Thank you, Claire, for a nice cup of tea. Sorry. Gabriel, yeah?
Yeah, sure. I mean, very interesting research that has just emerged where instead of maybe researchers looking exactly at the effect that antidepressants had on the depression, probably the first time they looked at how antidepressants affected overall health, and it was very interesting, the findings that their conclusion was that they possibly are doing more harm than good. That in some instances where they have a beneficial effect on the depression. But
that doesn't be on the leaflets in the box, Gabriel.
Well, I'm not too sure what's on the leaflets or the box. It's as far as I know, pretty fresh research, and it's the first time they looked at it at this perspective. Unfortunately, I mean, I think they should look at these things sooner, but they did determine that the benefits of most antidepressants, even taken at their best, compared poorly to the risks, which included premature death in elderly patients. So it was quite a severe finding that they found.
It is, I totally agree with you. But there is alternatives, isn't there?
Well, there is. I mean, I always use natural medicines to treat health conditions, and for mild to moderate depression, there's some very effective and safe herbal medicines. A few of them I mentioned in the article was there was ginkgo biloba, which an extract of this has shown in many clinical trials to have a beneficial effect on depression, but also fatigue, anger, and other neurological, symptoms. St. John's wort, probably the king of herbal antidepressants. Again, a myriad of scientific literature showing efficacy, effectiveness of St. John's wort for mild to moderate depression. And, in the likes of other European countries like Germany, they approach medicine a little bit differently in that in the pharmacies, quite a lot of the medicines will be herbal medicines, and the doctors over there are trained, do some training in herbal medicine, and therefore prescribe them. And an interesting statistic was that St. John's wort comprised of 25% of all the antidepressant prescriptions in Germany there a few years ago. So it is something that mainstream medicine uses quite well, because the research shows that it works equally effective to Prozac.
Okay, well, we used to call it St. John's wort when we heard about it here, the under-the-counter medicine.
All right. I mean, I guess it used to be over-the-counter, and the background to it is, I think maybe 5 years ago, it was then banned from over-the-counter sale. And the reason is it does interact with a small class of pharmaceutical drugs. As medical herbalists, I prescribe it all the time, but we assess through a consultation that patients aren't taking these small casks of pharmaceutical drugs. Outside that, it's very safe and effective.
Okay, can I ask you, Gabriel, for people that you do prescribe St. John's wort to, I mean, what are they saying? Obviously, the benefits are good, are they?
Very good, and Traditionally, it wasn't used in the traditional texts. It doesn't mention depression anywhere. Traditionally it was used, and this, when I mean traditionally, over the last 200 years, we'd say, it was used for anxiety, insomnia, and the menopause. So there are the three indications that when I looked at the traditional literature that it was used. But if you break it down, it's very much a nervous system tonic. So anything that's based on the nervous system, it'll be a tonic for. That includes stress, anxiety, panic attacks, poor sleep, and insomnia, and other very, very common ailment these days. And then I guess why it was indicated traditionally for the menopause is that there is, again, nervous system symptoms that are attached to the menopause, and again the anxiety and maybe mood swings and so on. So it in general is what we call an anxiolytic, and it's a very beneficial tonic for the nervous system and all conditions that are based on the nervous system.
Okay, so if I wanted St. John's Wort to see would it work with my depression, just an example here. Obviously, I'd have to go to somebody like you, and you'd have to prescribe that for me.
Yes, in the south of Ireland, that's the way it happens. And but some people feel that because of that, it's on prescription that it's dangerous, and it's important to know that. Outside the fact if someone's taken a small cast of pharmaceutical drugs that it could interact with, outside that, it's very safe and very effective if taken in the right dose for the right period of time and so on. And where indicated,
Okay, Gabriel, you do know when people go to the GP and they get the prescribed medication for their depression, anxiety, in particular depression, they're told by the GP and told on the leaflet in the box that this could take 4 to 6, maybe 8 weeks before it kicks in. What's the story then with the herbal medicines and the alternatives, or the complementaries?
They look at this in the clinical trials too, and the likes of, say, St. John's Wort, which is probably the most studied, it also needs to be taken for 6 to 8 weeks before you clinically assess it. It's the same with ginkgo, actually. Others, it's not the same in that if you take for a few days, they would have an effect after a few days, specifically for nervous system things like sleep and that. But to do with St. John's Wort, it seems that it needs a saturation level to be built up in the body before you'll have a clinical before it'll have a clinical effect. But that's not in my clinical experience. It's not in all people. Some people will receive the benefits straight away.
Okay, if somebody comes to your clinic, Gabriel, and they are on medication from their GP at the moment for depression, and they are interested in trying out, maybe they're saying that the medication they're getting from the GP, they don't find beneficial, and that can happen as well, and they want to go on St. John's Wort. How does that work then?
Yeah, well, they'll have to consult with their GP on discontinuing their medications. Always talk to the doctor who prescribed them. They shouldn't really try and come off them themselves in case there's an adverse effect. With regards to people coming to me who are on prescription medications, if their medications don't interact with herbal medicines that I'd be using, I prescribe them in the right dose. If they do interact, then if there is a contraindication, I wouldn't prescribe them for that person, and I'd recommend others. So, I mean, with herbal medicine, we don't just have, say, one herb for a symptom or a condition. We have many, and generally I formulate herbs, so I might, in the case of, say, depression, I might use maybe 3 or 4 nervous system tonics that would have a synergistic effect on each other, and therefore have a beneficial effect on their condition.
With Hania?
With Hania somnifera, it's an Indian herb that comes out of Ayurvedic, but again, it has a lot of clinical trials to show efficacy in depression and seasonal affective disorder, and it has been compared in trials to prescription antidepressants, and it has been shown to be equally effective to some of them as well. It's also an adaptogen tonic, so again, it's good for the nervous system. If someone's going through a stressful event, we use adaptogen tonics, and that may be exams, it may be a bereavement, it may be running a marathon, or well, say for the likes of yourself, an enthusiastic mountain climber, you could take it before and after. Athletes take adaptogen tonics. I take them myself on and off. But it has an indication for mood disorders and affective disorders like depression as well. All
right, I need to talk to you about some other things here. First of all, the importance of vitamin D for us all, Gabriel.
Definitely, vitamin D is extremely important in Ireland, and the reason being is our latitude. Our best way to get it is from the sun. We synthesize it in the skin from UV exposure. Because of our latitude, we really can only do this about 4 months of the year, maybe 4 or 5 months.
If we're lucky, yeah.
If we're lucky, and because of that, now that we seem to be doing more research in this area, it's emerging that we're all either deficient or insufficient in vitamin D. Vitamin D then in trials has shown to have beneficial effects on mood, and therefore when regarding depression and affective disorders, it's extremely important to add to the advice that I would give. I'd always prescribe vitamin D to people with nervous system disorders as well,
And vitamin D can be found in the all reliable, good quality cod liver oil.
Sure, it was a traditional source of it for people of our latitude in Ireland, and we've been taking cod liver oil for 60 years in Ireland. It's been there since. Obviously, eating fatty fish is good too, but it's one of the dietary sources. The only place vitamin D exists naturally in the diet is in fat and blood. And, we've been going low fat now misguidedly for 35 years, and we don't really eat as much blood products as we used to traditionally either. But this is where we used to get them traditionally. We used to eat a lot of these foods. Organ meats is also high in vitamin D, liver, kidney. Again, we don't really eat too much of these anymore, unfortunately. And also to mention, regarding depression per se, is physical exercise. If there's anything that's the best medicine out there for people who suffer from depression or mood disorder, it's physical exercise. And the funny thing is when they study these in clinical trials, one outcome was something like 5 or 10 minutes walk 3 times a week has a beneficial effect on depression or something. But, to me, that's a very, very small amount of exercise. And really, people should be getting out. If they're going for a walk, get out for an hour if they can. If they can't, maybe a half hour at lunch break or something. Or, we really should be, doing this on a daily basis. Especially in the summer months, we should get out as much as possible, expose ourselves to natural light. It goes in through the eyes, has a very beneficial effect on nervous system disorders such as depression, and it's extremely important.
I see advertised now in some magazines where people can buy these lamps for light. People who suffer with depressions. Have you heard anything about those?
Sure, yeah. I think they're called sun lamps. I'm not too sure how they're used, but I think you put it on your desk, maybe near your PC or whatever, and you can turn it on maybe a few times a day. Again, I'm not too sure of the dose or how they work, but I know they exist, and they don't work by producing vitamin D in your skin, and a lot of people think it's that, but it's not. It's actually this. It's more complex, but it's to do with the light actually entering the back of the eyes, the cones that are in the back of the eyes, and these go to the pineal gland, which are glands in the brain, and the pineal gland then produces certain neurotransmitters like serotonin and melatonin and all these kind of hormones that we need for mood. There's a lot going on there, but to boil it down to a basic tip or rule of thumb would be to get as much natural light as possible. Now, these days, we're more cavemen these days than we were hundreds of years ago, because we get up, especially in the winter months. We're indoors under artificial light, and then we get into our car. We drive to work maybe, and we could be in work all day, and then we come out of work. It could be dark, or we drive back home or whatever, and we may never really get too much natural light, daylight into the eyes. So we're under natural light a lot, and then we look into computers, unnatural light. We look at the TV, unnatural light. So we're getting a lot of junk light in through the eyes instead of real natural light. And though it's subtle and it's cumulative, takes time to maybe create adverse effects, it's extremely beneficial when you're treating things like depression to have as much exposure as possible to natural light.
Okay, just to rewind then, you talked about Jingo and you talked about St. John's wort there, and I mentioned Withania. Those are just some of the herbs, yeah? Yeah,
sure. I mean, I could go on: lemon balm, motherwort, valerian, humilis. There's a myriad of that class of herbal medicine that would call nervous system tonics. And it can all be used in depression, but they'd also have other indications. So depends if there's something else going on for the patient. That's what we use to, after the consultation, we decide which herbs we'd put in the formula. Sometimes I put them nearly all in there.
All right, and I'm just looking at a text here. It says, interesting conversation there, Johnny. Thank you. Just like standard medication from your GP, if you go on St. John's wort, is it for life?
No, not at all. I mean, in the trials too, we address things like dependency and tolerance, which are very important. And dependency meaning, when you take it for, we'll say 3-4 months, and it has a great clinical effect, are you dependent on it? That means when you stop, do you regress? It's not shown to work like that, in that some people might take it for a number of months through the winter, and it just helps their mood through the winter months, and then they don't take it through the summer months. So they might take it half a year. But the important thing to note is they're not dependent on it, so there's not a withdrawal from it, Tolerance is something where, I used to take 5 or 10 mils a day, and after 4 months, now I need to take 20 mils a day because I need to take more to get the same clinical effect. So St. John's wort doesn't work on that basis. Some people take it all the time, and it's very safe to take all the time at a certain dose because they're comfortable taking it all the time.
Okay, just before you go, I'm looking at another text here, and this has got something to do with anxiety or depression. It's maybe something you and I, and then again, you could have an article in weeks to come, and we can pick up on again. It just says, is there a herbal remedy for thyroid gland?
Yeah, well, there's a number, and it depends on what you want to do with the gland. But generally, our sea herbs were used traditionally for thyroid. So, I just hazard a guess to say that the caller was talking about an underactive thyroid, which is more common than an overactive one. And again, we'd use different herbs for the different situation. But the likes of it's Fucus vesiculosus, which is a sea vegetable or sea herb, is probably the main one that I'd use clinically. It has a nourishing effect on the thyroid gland. It contains iodine and certain minerals that nourish the gland. And for people who are hypothyroid or have an underactive thyroid, I'd use it. I'd use kelp, which is another herb that has a beneficial effect on the thyroid. And then if it was to swing the other way, if the thyroid was overactive, there's certain herbs like bugleweed that would have a suppressant effect on the thyroid function. So it all depends. It depends on how their thyroid is going.
All right then, Gabriel. And in the first instance, if anybody is thinking of going down this route, to speak to somebody like you, who's a nutritionist and, of course, a medical herbalist.
Sure.
Gabriel, as always, thank you so much indeed. It's been a very interesting conversation there. And we'll talk to you next week.
Thanks, Shawnee. Talk to you next time.
You're very welcome. That is Mr. Gabriel McSharry, based in Calry, County Sligo. Only a phone call away on 071-914-2940. I know you won't remember that, but maybe if I say www.westernherbalmedicine.com. You want to hear it again? Westernherbalmedicine.com. westernherbalmedicine.com. So be it, westernherbalmedicine.com. Thank you, Gabriel. Now, that's an interesting one regarding antidepressants and depression and anxiety. That's what it says. Commonly prescribed antidepressants. Published a paper. Now, these are not as such Gabriel's words. This has been done on research and so on in the USFA, like all things, and goes on to say all the different things. The findings include these risks: developmental problems in infants, problems with sexual stimulation and function and sperm development in adults, digestive problems such as diarrhea, constipation, indigestion and bloating, abnormal bleeding and stroke in the elderly. It goes on and on.
Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.